Hello everyone, I'm Barry Stagner and this is his channel news break. Cases of 3 common sexually transmitted diseases in the U.S. reached a record level in 2018 according to a new report from the Centers for Disease Control and Prevention. Gonorrhea and cases of primary and secondary syphilis, the disease's most infectious stages, both reached their highest levels since 1991 last year. The country's 115,045 syphilis cases included more than 35,000 cases of primary and secondary syphilis, marking a 14.9% rate uptick from 2017. Meanwhile, there were more than 583,000 cases of gonorrhea, a rate increase of 5% from 2017, and the rate of reported chlamydia cases rose 3% to total more than 1.7 million in 2018. Nearly 2/3 of which were among people from 15 to 24 years old, the report says. Together, the diseases accounted for more than 2.4 million cases, an all-time high since data on all 3 conditions was first collected in 1984. Syphilis, gonorrhea, and chlamydia can have serious consequences if left unchecked, including infertility and even death, but are treatable through antibiotics, yet, despite public health efforts to improve access to testing and treatment, the prevalence of such STDs has soared in recent years, representing an underestimated opponent in the public health battle, according to the report. Officials pointed to a combination of factors that appear linked to the increase in STDs, including social factors that can affect access to health care, like stigma, drug use, poverty, and unstable housing, as well as risky sexual behavior and slash funding for STD programs across the country. Boland says increased and improved testing contributes to the higher numbers in recent years, but can't completely explain the growth. The situation is multifactorial. There's not one simple explanation for why we're seeing significant increases every year, she says. But the good news is that we're actually doing a better job of documenting cases and understanding what the missed opportunities are in those cases so we can focus on interventions to close those gaps. Health officials are trying to stay ahead of the curve to prevent states with fewer congenital syphilis cases from seeing a surge, Boland says, and helping women seek prenatal care early in pregnancy and ensuring that their doctors are screening for syphilis and linking infected women to treatment would help prevent transmission, she went on to say. Pregnant women who don't have syphilis but may be at a higher risk of infection, such as those who live in areas with a concentration of syphilis, should be tested again in their 3rd trimester. This is affecting the health of our nation, Boland says, and it takes a village, and we all need sectors really getting involved in trying to reverse these trends. President Lenín Moreno has imposed a night curfew near government buildings after protesters clashed with security forces inside Ecuador's heavily guarded parliament. Demonstrators briefly burst through a police cordon before being driven back with tear gas, as witnesses said. Mr. Moreno declared a state of emergency last week, but has failed to end protests led by indigenous groups. They're demanding an end to austerity and the return of fuel subsidies. Petrol prices have soared more than 100% since last Thursday when the subsidies were removed. The unrest has forced President Lenín Moreno to move the government out of the capital city. Well, civil unrest, as well as rising pestilence in the last days, gives us today's reminder to keep looking up.